Let's talk exercises for posture. You know, it's something that a lot of us struggle with because of our lifestyle in this day and age with our cell phones and our computers, all causing our head to pull forward, our back, our thoracic spine to round, and our shoulders to roll forward. Now, these movement patterns can lead to things like tension headaches up in the back of our head. It can lead to flattening of our cervical spine and stenosis. We can get shoulder pinching pain, tightness, all kinds of things that as we get older and health is an important piece, we want to prevent. So how do we do that? At Kinetic Balance Fitness, I personalize warm-ups with mobilizations, activations, which is where we're at in these exercises, and integrations to help improve your movement patterns that ideally lead to less pain, less injury in a way that we can control as best we can. Focusing on health is longevity. So today I want to talk to you. Last week we talked about our head position, pulling that head back with deep cervical flexor activation. Now what's tied with that is once we pull our head back, we also want to pull our upper bone, our humerus, into external rotation. The answer to that is not rows and pinching those shoulder blades together, activating those rhomboids. Our rhomboids actually pull our head forward and lead to more pain and postural patterns. So what we actually want to activate is external rotators of our rotator cuff. And to do that, we want to get isolated activation of those muscles. And this exercise does that. And in the process, it helps support good posture. So I'm going to be demonstrating with a monster band. Those little tiny loop bands are really hard because they get tight really quick at that external rotation. So I recommend a monster band, a pull-up assist band, or a tube band here. And an open wall space. Now to set up, we're simply going to move those feet slightly away from the wall so that our bum can relax back. And then we stand up tall, all right? Bum touching the wall, back of the shoulders, and the head. So we want to practice that deep cervical flexion so that we're ears over shoulders over hips. Now we take that resistance band and we're going to choke up on it. So we're going to be nice and narrow and we're going to have the palms facing up towards the ceiling. Now we're going to glue those elbows to the front of the ribs. This is what helps isolate those rotator cuff muscles. You've probably seen these kinds of things where we're up against the wall, but by sliding those elbows forward, we take out the posterior delt and isolate the external rotators of that rotator cuff. So palms facing up, elbows glued to the front of those ribs, and we're simply going to, with a 3 or 4 count, pull into that band, almost pointing our thumbs towards the wall behind us. It's not a huge movement. We're going to hold for a 3 or 4 count, and then it's a slow, controlled release back. 3 or 4 counts. So 2, 3, 4, pull out into that band. 2, 3, 4, release back to start. This allows us to get endurance on that upper arm, that humerus bone in the shoulder joint, on those rotator cuffs, external rotation, so that we can help improve the position of our humerus in the shoulder joint, help us stand up taller while practicing that positive posture. Now, a side note, if you are somebody who has a narrow waist, a wonderful hourglass figure, and you find it hard gluing those elbows to the front of the ribs, or you get any kind of pinching, you can simply take a tea towel, roll it up, and use that as a cue not to let those elbows pull apart, because as soon as those elbows pull away, we're going to start getting more of that posterior delt rather than isolating those muscles on the backside of that shoulder blade. And that's right where we're going to feel this burn. So use that tea towel as a reminder or as a cue, whatever's comfortable for your body, so that you can get the most out of this exercise. And looking forward, to hearing how this exercise feels for you. If you're noticing a difference in your posture or enjoying these mobilizations and activations, because I'm gonna be bringing a challenge your way that's gonna be personalized to you based on a comprehensive movement assessment. So look forward, give these a try, let me know how they feel.